Maxine wants to know how long does the speech impediment last? And Tori wants to know that she's worried about not being able to speak properly.
Okay, so I'm assuming both Maxine and Tori have had their LTPs fitted?
So Maxine's probably have hers fitted. Tori is, I worry about not being able to talk properly, so she'll probably need...
Oh, I see, right, okay. So Maxine, if you've had your prosthetics fitted, when we reposition the prosthetic in the mouth into a new position that is new to you after a very long time, speech is controlled by both the lip and the tongue on the inside. This has to readapt to this solid object that's sitting in the middle. And the analogy I use to people is it's a bit like being 6 years old again and then going through to the age of 12. So if you notice, a lot of 6-year-old kids have a lisp, and then as time moves on and the teeth erupt into the right place, that lisp goes away.
Mm-hmm.
In my experience, the longest anyone I've ever known is taken to adapt is 2 years. And that was an extreme case of somebody who'd had all their teeth removed at the age of 11. And she came to see me at 62 years of age after wearing full dentures and having a sheet of plastic in the roof of her mouth for over 50 years. And she just struggled with adapting because she'd spent her entire teenage years and adulthood with a sheet of plastic in the roof of her mouth. She just couldn't get used to it. But 2 years, miraculously, she went on a night out with a friend, had a few too many sherbets, woke up the next day, and the lisp was gone. I don't think that's a scientific cure, right? I'm not recommending it, but what I'm saying is we know that everybody adapts, but everybody adapts differently. It's got a lot to do with your start position. It's got a lot to do with what you had before, and it's also got a lot to do with individual adaptation. I'd like to know how long you've had your LTP for, so I can give you an indication as to where you are in that journey.
I think for me it was about 6 months.
About 6 months?
6 months, because my tongue needed to find its place again, and my brain also needed to kind of like say, something is in your mouth, it's not yours at the moment, how am I going to deal with it? And it was about 6 months, and then my list definitely went.
Well, it's the same for me as a hip replacement. You know, some people adapt to it really quickly.
Mm-hmm.
Other people struggle with it. I mean, my mother had a double hip replacement, and it took her 14 months, and it used to infuriate my dad because he was an orthopedic surgeon. He said, "What is your problem?" And I just said, "It's how long it's taking her, Dad." You know, it is one of those things. But again, there are things that you need to keep in touch with us and tell us. Feedback would be good. A simple thing you can do is you can take a video of yourself and say, "She sells seashells on the seashore," and send it to us.
Yeah.
So at least the clinicians can look at it and know whether it's an adaptation issue or whether we need to do some contouring on the actual prosthetic itself, which we generally, particularly at the back, don't advise, and we try and keep it in the front area. But the more information you give us, the better. Because remember, we're trying to figure out or trying to get you back as close to where you should have been had nothing gone wrong in the first place. And that is always the struggle, not just for us, it's for any clinic doing this anywhere in the world. So we know that adaptation is part of the process, but it's no different to me than getting a hip replacement. But if you have a problem, please, you should let us know. Send us a video at least. You don't need to travel in, just send us a video. Tell us exactly what the problem is, so at least we can evaluate it.
See you.